Good morning, and thank you so much to the association for inviting us today to talk to you about collegiate recovery programs. And a special thanks from me for allowing me to do it remotely, because I know that is always a challenge. But it seems to be working pretty well so far. Mary and I began SAFE Project because we lost our son to an accidental overdose on his fourth day as a freshman in college. Because of that, among the many programs that our nonprofit, SAFE, is pursuing nationwide, one of our most important is what we call safe campuses. I'd like to tell you this morning a little bit about what happened to us and how a collegiate recovery program can help prevent the same thing from happening to one of your students and their family. It all begins for us with our son, Jonathan, who was a terrific kid, grew up in a military family, moved around a great deal, suffered from anxiety and depression, and was misdiagnosed with attention deficit, was misprescribed Adderall, and began self-medicating with alcohol to come down from the drug at night. We don't have time for all the details, but eventually Jonathan entered the spiral of addiction, and we knew we could no longer keep him safe at home. So we put him into a long-term treatment for what we thought was alcohol, marijuana, and Xanax. At the time, we not only didn't know about his involvement with opioids, we were unaware of the hazards of transitioning out of treatment and into long-term recovery. And as I mentioned, we lost him on his fourth day of college. So let's rewind the tape a little bit. While John was in his 15 months of treatment, he gained his emergency medical technician qualification. He was very proud of that, and we were proud of him for doing it. As we were considering how John might transition back into society, he decided he wanted to become a paramedic fireman, and attending college was a great way to get on that path. We didn't know anything about collegiate recovery as we were researching the colleges that he might consider attending, but we were interested to see what kind of programs they had to support people in recovery. The school that Jonathan chose advertised that they had a sober living floor in one of their dorms, and they also had counseling support for students. And that all made sense to us. After we applied for the program, we found out that not enough people had applied for this particular sober living floor, and they were going to have to shift to having a sober corner on one floor of a dorm. And then on the day we dropped him off, nobody had ever even heard of this in his dorm. And I'll always regret not simply pulling him out of school at that moment. But again, we had no idea of the life-threatening condition that he was in. This college, the University of Denver, had no collegiate recovery program at the time. If they had, Jonathan would have willingly joined it because he wanted to live and he wanted to continue his recovery. Well, DU now has an active, innovative, and growing program that we fully support. We know they've probably already saved at least one life. We want to encourage schools to have a program before tragedy strikes. And for those few colleges and universities that do have a program, we'd like to see them up their game as high as they possibly can. Now, we feel strongly enough about this that we've included in your packets an article that I wrote in USA Today this summer, right before the new school year commenced for most schools, in which I describe the 5 why it's important for parents to ask whether or not the college or university that their son or daughter is going to attend has such a program, even if they don't think their son or daughter has a problem with drugs or alcohol. The first reason is that a son or daughter may have an issue and his or her parents simply don't know it. Parents are proud of their kids and don't want to think of them as having a problem. Often, parents are either in denial, or they're living with hope as a strategy, or they simply don't recognize the signals of a severe, moderate, or whatever mental health or substance use problem. Second, a son or daughter could easily develop an issue while they're actually in college. Consider the 3 pathways into addiction. The first is the party path, and I don't even need to get into how much partying happens on campuses. It's a reality. The second path is overprescription of pain medication for a medical or dental procedure or injury, or worse, having a friend hand it to you. It's possible to get addicted in as little as 5 days to these medications, especially if one is predisposed to becoming substance dependent. By the way, that's also a very good reason for campus medical personnel to use caution in prescribing and to give appropriate warnings about use and disposal when they do. You simply don't need to have opioid pain medication when your wisdom teeth come out, which happens to so many college students. The third path into substance use disorder is what happened to Jonathan, self-medication for a mental health issue. When you consider the pretty high percentage of young men and women entering college who will self-identify as having a moderate or severe mental health issue, it's no surprise that when you layer on top of that the additional academic stress associated with being in a new environment, that many of these people can have a severe mental issue that could cause them to self-medicate using drugs. Now, the third reason parents should care about whether a college has a program is that someone's son or daughter may actually be able to help someone else's son or daughter who's hurting if they know the college has a program. And we have actually seen this happen. The fourth reason parents should ask this question is that the existence of such a program is a clear indication of how much a college really cares about their students and how much they've overcome stigma. I think some schools are self-stigmatized about this issue. They don't want parents of high school seniors wandering around their campus, seeing signs, offering help to students with substance use issues. I'd like to think that many of these parents, and I've talked to many of them, would actually be pleased to see that a college is wise enough to have a collegiate recovery program and to support their students. And finally, the last reason is that a well-publicized program on a campus builds college graduates who are better citizens, including those who have no issue at all with substance dependence, who naturally will have less stigma about this crisis affecting our nation if they see that recovery support is just another good service and that substance dependence is a disease, not a moral shortcoming. Now, collegiate recovery programs are very effective when they're done right. There are a number of schools out there with really amazing programs, but it simply doesn't work to only offer counseling or referral resources for students. Students in recovery have to have a mutually supportive community in which they can be with people who are on the same journey. Moreover, students in these programs tend to have better GPAs, better retention rates, and better graduation rates than the rest of the student body. These people have been through a crucible and they want to get on with their lives successfully, and they're very determined. And of great importance to cash-strapped college campuses, these programs actually pay for themselves. We've actually put together an algorithm that will perform a rough calculation for any college or university as to how preventing students from withdrawing due to substance use challenges can actually provide enough saved tuition to fund a quality program. I've pulled out University of Denver as an example. If you can prevent about 3.5 students from withdrawing from Denver, you pay for their program. And when you consider that our algorithm will show of the frankly many students on campus who could have a substance dependency issue, there are about 87 that we calculate who would be willing to participate in such a program. That's overwhelming savings that can easily pay for a program. And we've actually run that calculation for every school in attendance today, and we can make it available to you if you'd like. Now, there are a few additional points I'd like to make before I turn it over to my lovely co-chair and co-founder, Mary, to answer a few questions. For starters, we've compiled a set of collegiate recovery program best practices, working closely with organizations like the Association for Recovery in Higher Education and Transforming Youth Recovery, and with program directors and students from several colleges and universities with which we've become close. We're now working with ACHA to mutually agree on these and then provide them to you members. However, I will give you a sneak peek at some general best practice categories to whet your appetite without getting into the nitty-gritty details. First, it's important to have at least one dedicated staff member to coordinate the program because there's a lot to do. Second, it's really helpful to have dedicated space aligned to the program. These students in recovery not only need to have a place for meetings, it really helps to have a place just to hang out together. DU has a little college right on the edge of campus that works very, very well. Third, some kind of recovery housing is needed for these students so they have the greatest opportunity to live in a safe environment. As an aside, We believe that the overdose reversing drug naloxone, otherwise known as Narcan, should be in the hands of every RA in every dorm on a campus. University of Denver has that now. It's incredibly easy to use and very effective at pulling someone out of an overdose, but it has to be used quickly. Fourth, it's important to publicize the program on campus, beginning all the way back to initial communications with accepted first-year students. It could actually increase your take rate if you do this. And fifth, there are a host of other programs, from support services to team building activities, that can lend great effectiveness to such a program, and we can provide you with those examples. There's a lot more, but I'd add that we'd be happy to put you in touch with an existing school with a good recovery program to get your own information from them on how they view the effectiveness of their program and how you might go about starting or augmenting your own. We're doing our best to elevate the importance of these programs on college campuses. We've contacted over 1,000 schools, and we have more to contact. This audience knows very well how collegiate health officials are bombarded with ideas. So we were delighted to actually hear back from over 100 of these interested schools, and we intend to be politely persistent with the rest, as well as the others we haven't yet contacted, because that's what it takes, and we really want to see these programs flourish. We're also putting our own money where our mouth is and reaching out to students who are actually in these programs through the 5 collegiate recovery leadership academies we have co-hosted over the last year. These academies bring in up to 50 students at a time from different schools with collegiate recovery programs. They receive leadership training, mentorship from others who've been in these programs before, and the opportunity to network. And they participate in a year-long project working with their mentor on some aspect of collegiate recovery. And they take their best practices with them and their new leadership skills to make their own programs even better. We've gotten overwhelmingly positive feedback, and we'd welcome your students applying to one of our academies. Finally, it's very important to us that these students who really thrive in their supportive collegiate recovery community, that they don't simply fall off a cliff when they graduate and move on, including moving to another city. For that reason, we're investing what we call Reconnect Ed. It's a web application that stands for Recovery Connect Education. It's a web application that's going to enable thousands of students across the nation to connect with others they might land in the same city with on the next stop on their life's journey and on their recovery journey, so they can create supportive communities after they graduate from college. We've already shown the beta version of this to a number of students who really liked it. It'll be out in time for this year's graduating classes in May in its full initial version. So once again, thanks so much for the opportunity to be a part of this very important event. We're excited about the opportunity to work with you to either help you start a program, or if you have one, to make it even better. It's the right thing to do for students who have decided to embark on this lifelong journey of recovery. Thank you very much again, and I'll now turn it over to Mary, who will answer your questions in person. Thanks.
Thank you. Okay, originally he was supposed to be here in person, and schedules got a little mixed up when he had a free day, and then they realized he's on the West Coast in 2 different locations with a day in between, and trying to get back here, as you all know from traveling, was a little bit impossible, so we made this work. But this is something that is very near and dear to my heart, obviously because of losing my son after 15 months of inpatient residential treatment, and watching him come out of that with his EMT and joining the EMT club before he even got to school, applying for a job to work for the Denver Broncos as their EMT, and then to lose him on the 4th day. A real quick story, when we got there and I found out that these services were not available, they had a new individual as their, and I'll probably get the name wrong, but the head of their health services. And I went up to him and I said, okay, this is what you're gonna have by next year. We're gonna have all these things done, and I'm gonna come out here and help you get these. And I think he was like, who is this woman? But it's so important. And I know a lot of times when people hear about this, they're thinking, oh, we need more counselors because of the number of kids that are coming in with mental health issues. But it's more than just, as my husband pointed out, counseling. It's about changing the culture on the campus. It's about changing that stigma. And this is a wonderful way to do this. We are producing our future leaders out there, and this is the only way that it's going to happen. We're even going as far as going into high schools and into middle school. I can go back to age 4, and now I know what the signs of severe anxiety are that everyone kept telling me was attention deficit. And it wasn't at all. It was anxiety going back to age 4. So I think, the country in general needs to change its view on how we look on mental health and substance use disorder. I think this generation, the generations that you have in your campuses, will help us get there. So any specific questions for me? And I know we can't. No one's supposed to raise their hand, I guess. So.
Well, we'll make a special exception for this
Okay.
one, Mary. How about that? If you have a question, I'm happy to mic run.
And by the way, the article, we have packets that are, I think, out back, where he talked about the article that was in USA Today. Also, as mentioned, we do have the algorithm that we did for all the colleges in here, so you can see what your numbers are out to, which will help you also go back to the administration and how to fight for this program. Another good way is to look, to get the word out to your alumni. You have several alumni out there that are doing very well that are in recovery. And they would probably be very, I would guess, supportive of a recovery program on campus. It's also not just about recovery, it's about prevention. I often think of these kids, they're at a tipping point when they're coming in. So this is a great way to ensure their success at college.
Thank you so much for being here. I'm with my colleagues from Cornell University. We do have a sober living house, which is slightly new. But my question, based on your experience with, the sober hallway being under-enrolled and then becoming the sober corner and then nobody knowing, what happens, is just a very general question, what happens when these programs are under-enrolled, and what happens when they're over-enrolled, and how do we manage that?
Well, under-enrolled, we know by the numbers that no campus should be under-enrolled in this program. So that goes back to getting the word out. Those kids over the summer when they're first accepted are getting bombarded with emails and all different services out of campus. That first day when they get on there, there's orientation. That week they do team building and orientation stuff, and then at night it's socializing. This needs to be injected at every single point. It needs to be right up front. It needs to go to the parents. It needs to go to the students, whether or not anybody thinks there's an issue, but knowing these resources are there. And then continually throughout the 4 years, because they may have not have come in with one, but they may end up having a substance use issue. So when it's overrolled, that's when you got to start looking at your university and saying, we need more support. To this date, I don't really know of any program out there that's over-enrolled. I know of programs that are constantly fighting to keep their space, to keep their people, their dedicated staff. And again, I think that's where keeping in touch with your administration, showing the importance of this, getting buy-in from your alumni, as well as your students. I mean, for our upcoming conference that we have 50 students. We have 30 mentors for these students. We're flying them all in. It's pretty incredible. If you look at the mentors, they're some pretty senior people throughout business, throughout government that are coming in to be mentors, which to me is really exciting because you're showing, you can have a very successful life, healthy life.
If I can add a couple of things to Mary's answer, I would first tell you that when a program initially begins on a campus, it takes a little time to gather its momentum. So in the first year or so, you may find that you feel it's under-enrolled. You may only have 2 or 3 students. That's the way Texas Tech started. Texas Tech now has 120 students in their program. And they have, and to the other half of your question, they have to limit it at that amount. They can't take more than 120 because they just don't have the space and the expertise and the money to do it. But that'll give you a sense that these programs actually do build over time. You just have to be patient for a year or so while the sort of it gets into the campus culture.
Yeah, and that's key, culture, changing the culture.
Other questions? I have one for you regarding lower resource schools. So what would you advice or recommendations would you give to schools that really kind of don't have a lot of resources to start recovery dorms or even on-site facilities?
Well, lower resource, but also community. We want to see this community college, trade schools, and the like. And that is where you really get involved with your community resources as well. And we have our director of Safe Campuses, Samantha Forcom back there, and she's been going around and helping smaller, like community colleges. I think a beauty college that's out there, I'm sure that's not the right name, and helping them locate those resources in the community. That's when you really do need to go out and find. But even having some dedicated space at a community college, a room, an office or something where kids can go and just hang out in between classes is so important.
And at the community college level, it may surprise you. I think Samantha can give you a couple of anecdotes here where it's surprising there's actually money available sometimes in a mayor's office. You just have to go in and ask and present your case, and you might be able to get some kind of augmentation for some
very good point.
And then in a community that might have 2 or 3 vocational schools, community colleges, that sort of thing, it's possible, I think, to band those together under one program to try to get the economy of scale there.
And I think we're doing that even with larger. She was just recently up with Mount Holyoke and the sister schools up there, and they are combining their programs, I believe, and trying to have activities. So whether you're taking classes at another university, you know that there's a program there, someplace to go.
I was wondering if you have any recommendations about how to deal with a campus culture that is not supportive of recovery for all kinds of reasons, having to do with, if you acknowledge it, then you have to acknowledge that there is underage use, drinking on the campus, as well as, I think there's a lot of concern about reaction from alum and parents, and so we have some challenges. I'd be really interested in your thoughts about that.
And I think one thing, again, the article, why parents, that's what we're trying to get is the movement out there so the parents start asking the 5 things that he pointed out. Come to us about it and we will reach out. I mean, I think, and also showing the numbers of why this, if they won't do it because it's the right thing to do it because it's financially the right thing to do. And that's why we came up with this algorithm, because there are schools still out there that are like, we don't want to do this, the stigma. But if you show them financially, it's the right thing to do. Also, if there's a way, and I know it's hard, and Sam might have some other ideas, again, the alumni. There are a lot of alumni out there that are in recovery that are doing really well. And more people are coming out about their recovery. And I think that is an excellent way. So maybe trying to get out also through the Alumni Association and why this is so important.
Okay, great. One more question.
Hi, thank you so much. I think you said that RAs were equipped with Narcan somewhere?
At Denver University.
At Denver University?
There are other schools. You get them trained, they've actually trained their first responders, they had training for professors, they had training for staff.
Wow. Only because I know, like our students who are trained EMTs and our first responders on our campus, in our town, we have a lot of responders. But I'm wondering, was there pushback about having actual RAs actually having Narcan and being the ones to administer it? I'm just thinking about our campus culture and the responsibilities and the increasing level of responsibilities that our residential student staff are feeling to be having conversations with students about higher level mental health issues. So I'm just wondering how you worked with the administration around this issue of having non-medical people like EMTs having the Narcan actually on them and administering.
Did you, I got that. Is that
well, I can help with that. First of all, Narcan is not required to be administered by a medical professional. and you probably knew that, but I wanted to mention that. It helps to have training on how to use it. It's very easy. It's like a nasal spray. You know, you put somebody on their side, you squirt it in their nose, and they wake up. It's that simple. So I think overcoming some of the mystique associated with it as some kind of medical treatment is important. I think that we were not with DU. We encouraged DU to train their RAs and give it to them, and they willingly agreed. And we've gotten nothing but positive feedback from that. So I think it was sort of pushing on an open door. But different colleges have different cultures and that sort of thing. So it's sort of a case-by-case basis. But it's very easy to obtain. It's very easy to train. And all you have to do is save one life on your campus, and it'll make a huge.
And I think that also goes back to the culture thing, and it's going beyond just the Narcan and the opioids. It's what happens when you see someone who's passed out from too much alcohol poisoning. The Good Samaritan laws that are out there, that you're trying to get into these people, that you will not get in trouble if you call the ambulance for your roommate who is passed out and maybe aspirating. The flip side of that is if you don't have it and you have that fatality on your campus, how is that going to look? Especially now, because it is so much in the news. I mean, it can't be anybody out there who hasn't heard of the epidemic, of the opioid epidemic. They may not have heard of Narcan yet, but they've heard of the epidemic. And to me, that's a bigger black eye on a campus, having a fatality. And I know, even though DU did not say this to us personally, I'm sure that they were probably worried that there was some aspect that we were thinking of suing them or being negative in the press about them, and instead, trying to turn a bad situation into good. What your conference is all about. This is why we came in, to make a difference. It can happen to anybody, any child, any family, any demographic, economic background, whatever. So it's a matter, it still is an uphill battle, but we're going to get there. So, thank you.